as somebody who is known within the community of being a doctor within the local Muslim communities or Asian community, shall I say, there was a lot of questions arising because of the misinformation that was being presented to them via social media. The other issue is that it was going into communities that maybe they weren't able to access the correct information in a language that they could understand. A group of doctors around Wales started chatting and we said we need to do something about this. So we set up Muslim Doctors Cymru. We thought that the best way of dealing with so many questions being asked to us as individuals is come together and bring in a faith leader to answer the faith-related questions, and us as doctors to be able to answer the medical questions. And now, hopefully, what we've done is come together, and what started with a handful of doctors is now 130 healthcare professionals, which includes not only doctors, but key members of the healthcare system, which are nurses, pharmacists, medical students, radiographers. We are aware that there are health inequalities within communities, and our aim is to chip away at that.
So I'm a community nurse, so we manage patients in their own homes. We manage a team of Band 5 community nurses and healthcare support workers. So we look after people who are waiting for social care packages, basically. So the COVID pandemic, it highlighted what we were able to do, if anything. So there was positive outcomes. I think we were shown as a group of professionals, we were still out there looking after patients. It's just shown what we as a team, as a service, are capable of. There isn't anything that will stop us or that could stop us from being able to look after patients in their own homes. And I'd always sort of had it in my mind that I'd like to be a nurse, but I never thought that I could deal with the nitty-gritty, the blood and the guts of it all. But while I was a patient, I saw lots of things and none of it bothered me. I really wanted to do what those nurses were doing for me, and I was watching the nurses on the wards and I just thought I'd love to do that. I'm really pleased to be nominated on behalf of all of our district nurses.
I'm the dietitian here in Landmark Hospital for adult mental health and eating disorders. Diet and mental health is really tightly linked, and I think dietetics plays a real role in somebody's well-being and their mental health. I went to university in my 40s. As a young person, I very much wrote myself off education-wise. What it did for me personally in terms of my confidence, achieving those grades, and thinking, gosh, my brain can remember things, I can pass exams. I wasn't able to have a graduation ceremony, obviously, because of the pandemic. But what the team here did is they did my own ceremony and hired me the cap and gown. I know now who's nominated me, although she's not said so definitely. So I think she feels quite proud of me that I did sort of go back and, get my degree. That means a huge amount to me. Don't write yourself off, and if you have, then you can still go back and tackle it later, even if you are a grandma.
I'm a Macmillan lung cancer nurse specialist. I just found that I had a rapport and an interest in communicating with people with cancer. I undertook training to give chemotherapy. I've always thought that we're in a very privileged position. When people ask us questions, they are trusting us to answer those questions, not avoid them, and to be honest with them. Some people cope with the treatment very, very well and have very positive outcomes, very few side effects. Other people have a lot of side effects. So the conversation is not usually a one-off conversation. It's something that is carried on at future consultations and times. We set up a support group, patients and their loved ones who attended. The feedback's been so positive, overwhelmed really by how much we've learned. I've done a few presentations with regards to patient stories at local and international level, and it's such an honour to be able to actually tell that individual story, because that's the reason that people want to tell their story, is so that healthcare professionals can learn. I was very surprised by the nomination. It was a huge shock because I'm not somebody to be in the limelight, but it's a huge honour, huge honour.